Hey there, O'Grady here. Ever feel like original Medicare has more holes than drones over Jersey theories? That's where Medigap comes in. Today we're diving into supplemental insurance, the coverage that helps plug those Medicare gaps. Medigap. So what exactly is Medigap? Well, it's private health insurance that helps cover costs original Medicare doesn't pay. Think of it like a patch job for those healthcare potholes you'll likely hit no matter how hard you try to steer around them on the interstate. Here's some key things to know. It's sold by private insurance companies, and it works only with original Medicare. It's standardized across most states, and you do pay an additional monthly premium though. All right, how about an alphabet soup, because every other government thing has alphabet numbers or letters for it. So Medigap plans are labeled A through N. Each plan offers different levels of coverage. Here are the most popular plans. Plan G, it's the most comprehensive coverage. There's Plan N, it's a good balance of coverage and cost. Or Plan A, basic, entry-level supplemental coverage. And here's what it does typically cover. Well, you hope it covers all the stuff that Medicare doesn't cover, including Medicare Part A coinsurance, hospital costs after Medicare benefits end, and Part B copayments and coinsurance. It covers the first 3 pints of blood and foreign travel emergency coverage if you need that. How about the best time to buy Medigap? Well, your best window is during Medigap open enrollment. That starts the month you turn age 65, and it lasts for 6 months. Insurance companies can't deny you based on health conditions if you get Medigap during that open enrollment. The costs and considerations, well, monthly premiums, of course. How much is it going to cost me? The prices range from $50 to $300 and can vary by your age, where you live, which plan you choose, and the insurance company you choose for that particular plan. What Medigap doesn't cover? Well, prescription drugs, long-term care, dental care, vision, and hearing aids. Here's the best way to go about finding a Medigap policy. It doesn't have to be all that complicated, and so here are some steps to help you with that. Use the Medicare Plan Finder tool on Medicare.gov. All you have to do is enter your zip code to see policies in your area. Then compare the costs and benefits of different plans. Remember, the benefits for each letter plan are standardized. They're the same no matter where you go, so focus on the price differences. Contact your state health insurance assistance program, also known as SHIP, for free, and you can get free personalized help there. I did say SHIP, right? Call 877-839-2675 to get your local SHIPS number. And check with your state insurance department for information about available plans and any complaints against any of those insurance companies. Once you've narrowed down your choices, contact the insurance companies directly for official quotes. You should consider factors like whether the premium is based on your age, your health, or some other criteria. And don't forget, the best time to buy a Medigap policy is during your Medigap open enrollment period. That starts when you're 65 or older and you are already enrolled in Medicare Part B. All right, the pro tips, because every piece has to have pro tips, right? Compare plans from multiple insurance companies, not just take the first one off the conveyor belt. Don't just choose the cheapest option. Consider your health and potential future health needs. You can only have one Medigap policy at a time, though. All right, and don't be like the people you read about on social media who thought, oh, I'm in great health, I really am not going to need this. I'll go with a bare bones plan. Then, of course, the unexpected hospital stay happens and they wish they'd chosen more comprehensive coverage. I'm not sure what I'm going to do yet. Still researching all my options. Original Medicare or Medicare Advantage? Well, I like the idea of seeing who I want, when I want, rather than limited to choosing from a network. So for me, I'm leaning to original Medicare, but then I'll have to figure out a Medigap choice. It doesn't matter what I choose. or what I do, you need to choose what's right for you and your family. Do your homework, do your research. You're probably getting lots of stuff in the mail right about now, all about Medicare, right? Well, see if any of it makes sense for your situation. In our next episode, I'll break down prescription drug coverage. Yeah, D, Part D, everything you need to know about Part D. Remember, Medigap is about peace of mind. It's not just insurance, it's protection for your health and your money, your wallet. Yeah, that's important too. And don't forget to subscribe, and I'll see you in the next episode.